And little did I know that surely we need a health insurance program in Uganda.
The insurance company that I was.
Welcome, everyone. Thank you for joining us. I see we have some participants here on our Zoom call, and we're also sharing this on YouTube. It will be available afterwards, just in case you have to dip in and out. If you check our chat, I've shared a link to where our report that we'll be talking about today is on the Rocket Health website, and our glorious tech man today, Osbert, has shared the live streaming link on YouTube. So please feel free to share that on your socials. If you'd like to share a little bit more about what we're talking about today, I'd ask that you share with the hashtag UG Telemedicine report. Just writing this in the chat for you. There you go. All right, so I'm going to get started. Just give me 1 sec. All right. So today we'll be talking about this report that we've been working on some research with Rocket Health for 2 years now. We reached out to Rocket Health in order to do a research partnership when the pandemic started. So I am Anne Whitehead from Whitehead Communications. And we also have with us Mercy Abiro, Awila Mercy Abiro. I think you can see her here. She's our research coordinator. You'll hear from her a little later. And we're lucky to have John Mark Buanica, who's the COO of Rocket Health, our partner. Also, a mention to Dan Kayango, Dan Very there. He was a research lead on this project as well. And we've got Sandra and Osbert and quite a few amazing teammates at Rocket Health that we worked with. So I'm hoping that we can get through this in some short time, but I'd like to make sure that everyone has a chance to ask questions if need be. So please take a note. We will have a chance to answer some of your questions. What we're going to do is first I'll introduce the research, then we'll get some background from Dr. John Mark Buanica, and then we'll hear a little bit more about the research, just dip into a few other things of what we did with Mercy and Dan, and then we'll open it up to questions. So if you'd like, I'd be interested to see on the call, if you're able to use the reply function, just let me know with your hands up if you work in telemedicine, or if you work in communications, or if you work in research, so that we know kind of some of our fellow experts that we have in the room today. Even if I can't see you, I'm sure that we have some here, or some will join later. So we will leave our contacts at the end of this, and we welcome you to get in touch. We look forward to hearing what you think of the report, what you pull from it. We'll talk a little bit about what we learned about the telemedicine industry, how some of the market research and public opinion research we did actually factored into Rocket Health's strategy, what their experience has been during the pandemic in this opportune industry, and also what we learned from the methods, what we learned about research itself, and how that might be helpful and how people can take those lessons forward. So let me dive right in. As you may know, Whitehead Communications used to be a communication strategy firm, and it still is, but we developed a research side that really focuses more on market research and tracking online conversations, doing public opinion surveys, focus groups, because we found that although you can have a pretty good idea of what you would like to get done just from your own experience, if you don't have the data, it's difficult to make really big decisions, investment decisions, business decisions. If you don't really know why you're putting out the messages that you are, then maybe you're not putting out the right messages. So we really put our focus into that. And early in that process came the pandemic, 2020. And when the pandemic came, luckily, I was very blessed to already know John Mark and Davis, the founders of Rocket Health. We had the experience of road trips in Uganda together, so got to know each other years ago. So I reached out and I said, look, really interested in the market that you're working in. And they said, yeah, we're really interested in your research. And so we decided to partner up and see what we can do to find out about this industry together. And wow, we rode quite a wave over the last couple of years. So what we did to start off, we did some market research. We looked at who's in the telemedicine industry. We started tracking online conversations. So Dan might come back with a little bit about that, but we were using social media sites, especially Twitter, downloading information and analyzing who is active in this space, who's talking about these issues like e-health and telemedicine, and what are the main topics that come up in those conversations. We also did focus groups. So we kind of looked at two audiences in this research. One was Rocket Health's existing customers. So what can we learn from their feedback? And the other was non-customers across Uganda. And we were trying to look outside of Kampala, within Kampala, but also the rest of the country, to see what do people know about telemedicine, what do they think about it, what's the market potential. And in those focus groups, we also asked, what are your recommendations for improvement? How can we get out there? How can we be more accessible, be better known, and give better services? So we also did two surveys. We went and did a client feedback survey, which gave us a sample of over 100 people. And then we did a more comprehensive survey. It was about 400 people for a national survey. And that it's fairly strong, the way that we were able to source a good selection of Ugandans. One could say that it's about a 95% confidence rate and plus 5% either way in how confident you can be in the results. But we'll show you a few of those. So we also had the chance to review and analyze some of the company data because we work so closely with Rocket Health. We were able to look at their analytics, their social media presence, which campaigns were working, how that clicked through to the website, what the sales were like on their website, also to what extent customers were phoning in, how many inquiries are they getting, how many services are they giving, and how does that look over time? And then compare that to some of what we saw with the marketing campaigns and communication strategies that were being put in place, and also, of course, what was happening with the pandemic and how that affected things. So let me just introduce, I'll run through quickly because I want to give John Mark a chance to give you some more deep insight from the company itself. But I want to focus on, I should say that we won't be able to give you all of our results in this session, nor are all of our results in the public report. But part of our agreement with Rocket Health was that at least some of what we learned, we would share with the public so that this could be a learning experience for everyone. And here we are to do that. And I think some of the most useful and interesting results was the National Public Opinion Survey on telemedicine. So I'll show you some of that. First of all, who were we talking to? This is important. So we talked to about, 392 people. We used different methods. Some people were filling the survey online. We did a lot of phone calls. We did some in-person surveys. So it was a mixed method survey. And what we found was that most of the people, not most, but the largest portion of people, 37%, were in central Uganda. And then you could see some representation from the rest of Uganda as well. Most of our respondents were in their 20s and 30s. We had a different kind of selection of whether they were employed or unemployed. And it was pretty much, we really aimed for a gender balance. So it was pretty much 50-50 on gender. So we asked them about the importance of healthcare to them. And first of all, almost everyone said that their health is extremely important. We also found out how much of a demand, in a way, there is with people who need healthcare. So in our national survey, a little over half of respondents said that they'd been sick or injured and needed medication or medical care within the past 6 months. And about a third needed it within the last month. So that gives you a bit of a sense of how much people actually need medical care in Uganda. This was higher among the existing Rocket Health customers, which I would interpret means that someone who has a plan with Rocket Health may be more likely to have a chronic illness or have kids or different reasons why they need more frequent healthcare. And so it would make sense that they've had it more recently. Also, just looking at the kinds of respondents we're talking about, if we want to look at income and expendable income, we want to see how much are these people typically spending in a month. So the majority of our respondents that we talk to are spending less than 500K in a month. So that's what you're looking at. I don't know if you want to call that a typical Ugandan, but there you go. And then about a third are spending 500K to 2 million a month, and only 7% of our respondents were spending over 2 million a month. So that's kind of how much money they have to spend on everything, let alone healthcare, and how they value healthcare and how they might use it within that context. So first of all, we wanted to know to what extent Ugandans actually understand telemedicine, e-health, the idea of a remote doctor consultation. Instead of going to a clinic, you can call or text and get some medical help. So actually, more than half had never heard of this before. 58% had never heard of it. And 75% had never heard of Rocket Health. So we had about a quarter in there that were already kind of aware of what we were talking about, specifically Rocket Health, and more than half had never heard of this before. That said, about 81% said that they would be open to it, consulting a doctor over the phone. And depending on the situation, another 8% on top of that. So almost 90% would in some cases be open to consulting a doctor over the phone. Even if they'd never heard of this before, they were already open to the concept. And then it was even stronger for people who were open to having lab tests done at home. Someone come, and I believe this was the case as well, for medications delivered to your home. That sounded like a great idea for people who mostly hadn't done it before. So that gives us a sense of kind of the market potential here. And this was important for Rocket Health, which John Mark will tell you more about later. But the fact is that there was a mix match between awareness and the potential of the customers that were there. That's something we noticed through public opinion surveying. We also decided to ask about mental health therapy from home, which is something that I think has just become more and more important over the last, over the last 2 years with, the increasing stresses of the pandemic and everything else. And Uganda is a culture in which a lot of people may not be comfortable with mental health therapy. There's more stigma. In fact, that's the case the world over. So it was encouraging to find out that about 80% of respondents were open to receiving mental health therapy. Rocket Health was starting to look into how they might deliver this at that point. So we asked, and it looked like kind of the more close contact, the better. Some people just really felt you had to be in a room with someone in order to have a mental health therapy experience. But over half, 53%, thought that that would be fine over the phone. That would be their preference. 22%, there were some who would like a WhatsApp chat, and then others had said video and in person. So I just want to quickly start introducing a little bit of how the experience went for Rocket Health, but I'm going to hand this over to Dr. John Mark shortly. I'm calling him doctor, but he's a humble man. I know he'll say, oh, I'm just John Mark, but he is our Musao. So what we found is that and this is not exactly our survey results, but related to it. In the last couple of years, voice calls increased 3 times by over 300%. The number of people who got an insurance partner and had insurance with Rocket Health increased again by almost 350%. Online shop users increased by 331%. In addition to that, with COVID specifically, Rocket Health got into the business of doing COVID tests as well as care for COVID. They registered over 6,000 sales of COVID tests between November 2020 and September 2021. You're going to see this again, but I just want to touch on it. So we looked at some of the business data of when people were coming in or calling for teleconsultations. And we found that this was something that was quite related to what was happening in COVID. So if you remember, April 2020 was the first lockdown, and we see our first little bump in calls there. And then COVID had another wave in Uganda in September, and sure enough, we see the numbers increase, same in December. And then June 2021 was a terrible wave for COVID in Uganda, and there was a massive spike in the amount of people calling in. So that was the kind of business data that reflected an overall experience in the market. We also looked at the website data. And the interesting thing here is you kind of see the same thing, but it's a more steady increase. So July 2021 saw a big bump because there was this lockdown and COVID wave, and telemedicine kind of came to the rescue in a way. But you also see that there's a more steady increase over time, which to me suggests behaviorally that once people kind of got awareness and understood how this worked, they kept using it. So on that note, I'm going to stop sharing my screen and hand it over to John Mark, and he can tell you a bit more about his experience. Over to you, Musao.
Thank you, Anne. I hope everyone can hear me well. Thank you for the summary of the results. I think you and your team have done a fantastic job. And I also like to thank Sandra and her team for the work that they've done on this. My name is John Mark Boanika. I'm one of the co-founders of the company, and I also lead the operations and the research and projects department here at Rocket Health. And I would like to start by taking us back to why we started and why we do the work that we do. The vision that we see for the work that we do is to be the leading world-class digital health company in Africa, and we always say that we don't only want to be a leader in the market, but we also want to do world-class things. We want to be able to offer services that whether you get it here in Uganda, in Kampala, in Masaka, in Gulu, or wherever, that you'll get a feeling that this is something that is very similar to what you'd get in the best parts of the world. And we do this by designing and delivering innovative digital health solutions that across the different stakeholders in the healthcare value chain. So if it's patients, if it's doctors, if it's pharmacies and healthcare providers, the idea is that we are gradually increasing our service offering to be able to offer digital solutions that improve services and the product range for all the different stakeholders across healthcare. And the background and the foundation to why we think digital health and telemedicine is important is very clear. If you look at recent statistics over the last 2 decades regarding mobile and internet growth in our region, Africa is consistently one of the 2 regions of the world where there is the highest growth of adoption and usage of mobile phones and digital platforms. We see that even from the Uganda Communications Commission reports, which show a steady trend in mobile phone usage and internet usage and subscriptions. If you also look at the GSMA report, it's very clear that increasingly these are tools that we use in our everyday life. If you look at also things like mobile money utilization, e-commerce platforms like Jumia, Glovo, and all those other platforms, it is now second nature that we use these platforms for our everyday life. And so it's natural that we provide a platform through which people are able to access and get healthcare services using these digital platforms. And a number of people think that our services have just started during the pandemic, and that's a misconception. Our services have been going on for a while, and we started ideating around the idea of this digital work and telemedicine way back in 2011. If for some of you who are about my age or older, you could recognize that this is the first Java outlet on Bombo Road, and that's where the initial meetings were had, and this is when we were thinking about this work. And then we launched in August of 2013, and this was our basic telehealth unit, which is just a few computers and a basic call center. And at the time, the work that we're doing was mostly focused on just providing basic teleconsultations and nothing else. And at the time, of course, any other services like laboratory or pharmacy services would be referred to any service providers on the market and not ourselves. But over those years, the idea was to learn as much as possible and be able to get enough market research to allow us be able to provide the end-to-end service, which was our goal. And so right now, our service is composed of 5 components. It's composed of the remote teleconsultation. So anyone with a mobile phone, whether it's a basic feature phone, all a high-end smartphone, can be able to call and consult a doctor any time of the day, any time of the night. And based on the interaction that goes on with the doctor, we are able to send our laboratory technicians to come and pick up a lab sample from you. And we have our lab which processes the samples, and the results are sent to you via email. And our doctors will be able to call you and explain what the result means, and also give you a care plan. And that care plan might also require medicines for your health condition. And we have a pharmacy or 2 pharmacies where we actually have medicines that can be delivered to you. So our team of pharmacy technicians will come and bring you the medicines. However, we also know that not everything can be completed over the phone or remotely like this. Sometimes even after this engagement, we know that you might need a physical assessment, and we have a physical clinic where we can book an appointment for you to come and see our general practitioners, or to come and see our physicians. And so, you also are able to come and be seen physically. And then to cap it is we have the e-commerce site and, rockethealth.shop, where you're able to go and be able to browse all these services, purchase pharmacy products, book appointments, book laboratory services, and the like. This is just something that Anne had already hinted on. We've seen quite a bit of growth in the last 2 years. Now, like I said earlier, our work has been going on for a couple of years, and telemedicine and digital platforms have been used in even very many other countries for a number of years. However, predominantly, I think because for the last millennia, we've always sought our healthcare through physical means, and so a lot of people had not yet adopted to using services this way. However, the pandemic created circumstances which had to augment the uptake and utilization of services, and we see that clearly in the growth when it came to teleconsultations. Because of the lockdowns to curb COVID spread, a lot of people were not able to move to go to the physical facilities, and so we saw a huge spike between 300 to 600% growth in the usage of our platform. So was the case for the eShop website, and a lot of people were buying, especially COVID-related products like sanitizers, like masks, vitamins, and all sorts of things. And from the report that Anne and the team carried out, and indeed from our other observations and feedback from the different users of our service, it was clear that growth comes with also a lot of demands on the side of the company to be able to satisfy that growth. And one of the things was that we had to grow that team consistently over the last 2 years to be able to meet the high growth. And so our team has grown from a team of just about 70 people in 2019 to over 160 people currently. And as you can see, the team has grown, especially the team of field agents. Those are the laboratory technicians and pharmacy technicians that come out to pick samples or deliver medicines to you. And so we think that growth is going to get even higher, especially as we expand countrywide. The other thing is that because of the increase in the traffic in the call center, if you look at the previous pictures that I told you of the telehealth center In the years before, it was much smaller. But as you can see, as of today, the space is much bigger. We have a team of over 15 doctors that are able to provide the services 24/7, day and night, over the weekends, Christmas, whichever day will be available to provide teleconsultations. And then we also have a team of customer care professionals who are able to help people navigate these telehealth services, because we know a lot of people may not know how to use the services. And so we have a team that actually helps people navigate or follow up on their queries, on samples that have been picked, on results that are pending, on deliveries that have not reached, and the like. Because also some of the feedback that we've got as part of the growth over the last 2 years has been around our delivery time and response time when it comes to picking samples. We've grown our field team, and now it's close to 70 people, and this includes nurses, pharmacy technicians, lab technicians. These are equipped with motorbikes and all sorts of safety gear to be able to come to you, to your home, to your office, to wherever you are, to deliver your medicines, to deliver your pharmacy products, to pick up your laboratory sample. We've also had to do internal expansions when it comes to our laboratory services to be able to process more samples and be able to deliver results on time. So has been the case for the pharmacy, where we moved from a much smaller pharmacy to occupy a much bigger pharmacy, so that we are able to offer a wide range of services, a wider range of services, but also to build the team that are able to prepare the orders that come to you. In terms of partnership, one of the comments that was highlighted through the report that Anne and the team have shared was the need for us to partner with other bigger brands, so that there's more credibility that is given to our work, since it's new on the market. But also internally, we realize that these kinds of partnerships also help us to be able to serve more people. So, for example, our partnerships with Safe Border and Glovo mean that we have a larger fleet of additional people to deliver our products to the people beyond our internal team. We've also partnered with entities like MTN Pulse to be able to help us to publicize and build more brand awareness about the service, as well as co-create packages that are appropriate for different population demographics. We've also, invested quite a bit in more brand awareness through things like the website, things like banners, things like billboards, because a lot of people did not know about us as Rocket Health, but as well as not know about telemedicine, and we're trying to get more people to be aware of the service and how to use it. One of the things that we are very keen on is to be readily accessible service, and we've been keen on maintaining a lot of easy platforms to use. And one of the introductions that we worked on last year was the USSD code, which allows anyone with any form of phone, whether it's a $2 phone or $1,000 phone, you're able to access our service. And this is from simply pressing *280# on your phone, and you get a menu, and then you choose which of the services you want, and then somebody from our team is able to call you and direct you and help you get that service. What this allows is it allows us to tap into all socioeconomic demographics, and not just only the elite who are using the smartphones. However, we know that a number of people are able to do a lot of things on their own, and so that's why we have the Rocket Health Shop, which is an e-commerce shop, which is one of the most popular platforms, access platforms for us. And through this platform, you can be able to to go and browse our services. You can be able to purchase, make orders for pharmacy products, make payments, and then you'll have it delivered, order for laboratory services, home vaccinations, teleconsultations, as well as make bookings for our clinic service. We know that our service, especially the delivery service and pharmacy service, has been largely focused in the areas of Kampala, Wakiso, Mukono over the last few years. The teleconsultations can be accessed from any part of the country, any part of the world. However, one of the focus areas for this year and beyond is to expand and have physical presence and dispatch units and dispatch hubs in at least tier 2 cities and villages across the country. And so we're going to see a lot of those open up over the next over this year and next year. And so that means that we'll have more presence in towns and localities across the country, and as such we'll be able to serve more people and have a shorter response time. Thank you.
Thank you. Thank you, John Mark, so much. So what I'll do is we have about 20 minutes left in the hour, and I would like to give a chance for some of the teammates to share some of their experiences and learning. If you'll just give me 1 sec here. I'm sorry, I'm having a bit of trouble with my screen share. Okay, there we go. So I'd like to pass it over to our research coordinator, Mercy, if you're able to tell us a little bit about your experience and what was learned there.
Thank you very much, Anne. A good afternoon, everybody. My name is Owila Biro Mercy, and I'm the research coordinator at Whitehead Comms. So during the process of the research, one of the methodologies we decided to use was focus groups. And due to the limitations brought by the pandemic, we decided let's use the WhatsApp as a platform to conduct the focus group. It presented both opportunities, but also challenges. Opportunities being it was the first time we were venturing into the WhatsApp space to sort of get people's opinions about telemedicine, but also it sort of proved to be a challenge to us because it was difficult to hold people's attention and keep the conversation going live because people would log in at different hours. And then also when we're doing the focus groups, especially for the existing clients that Rocket Health has, we decided to leverage on the contacts that they have through their channels. And we use their call centers to basically conduct the surveys so as to get credibility, because it's not for us as a team, we thought it wise for people to actually hear from Rocket Health as a company itself. So our main findings from the focus group, especially for the existing customers, was one, they appreciated telemedicine because one of the things they said was it reduced the time in which they'd have to spend in hospitals. That is to say, the long queues, knowing how the Ugandan medical system is like. So having to spend less time in queues in hospitals was a very, very big deal for them. And then for the non-existing customers, one of the main things that they mentioned was they are open to actually telemedicine services, but also it sort of proves to be a challenge, especially in spaces that are that do not have connectivity. Knowing how the communications infrastructure is within our country, you might find that some areas have connectivity and others don't. So one of the highlights that the non-customers pointed out was the connectivity, but also they had reservations. Some had reservations about telemedicine because one of the questions they had was, how do you trust somebody across the phone with all your medical information? So in terms of telemedicine, as a Ugandan market, we aren't yet there, but we are definitely getting there. One of the strategic recommendations from the focus groups was they hinted on the partnerships that Rocket Health would create with these well-known brands across the country. And Dr. John Mark hinted on that at the start because many people trust physical doctors and not somebody on the phone. So they really recommended having partnerships, but also they recommended the need for more awareness in terms of advertising. Talk to people about telemedicine so that they can get converted. One of the challenges that we had with the methodologies, because it was a mixed approach really, was one I mentioned earlier on, the attention on the WhatsApp focus groups, but also when it came to the phone calls that we were doing for the surveys, we had issues of language barrier, because just as we know, Uganda is multilingual. So you might call somebody, say in Mbarara, and they speak Runyankore, and you have to get somebody who speaks that language because you want to get the opinion of somebody who hasn't experienced the service. So one of the challenges that we had during the call sessions was always language barrier. Then for the online conversation tracking methods that we used a robust system, basically data scraping, as Anne had mentioned earlier on. And with some social media platforms, they don't really give you all the data that is there. So most times you actually have to use open source code in order to actually get that data off the sites. But the data from those sites is not always conclusive. So it was one of the challenges that we had while conducting the research. But with the feedback and the data that we had collected, it showed us that Rocket Health One has the potential to actually grow as a business, and it also has a potential to actually serve people within the medical field.
Thanks, Mercy. I'll just pass it to Dan briefly, and then we'll give you guys a chance to ask questions. Dan, please let us know about your experience. Oh, sorry.
Hello, good afternoon, everyone. My name is very Dan Kayongo, research associate with Whitehead Communications. So we used a couple of tools to track online conversations, well, majorly social media listening tools like Keyhole, Brand24. We used Rival IQ for competitor insights and competitor analysis, basing the current competitors in the telemedicine industry versus Rocket Health in terms of social media, analytics and insights, website visits, and all these tracked into the decision making. And we used Google Alerts to be able to track and monitor online activity, majorly basing on new articles that would come out basing on telemedicine or health in Uganda, anything that Google could pick up that would able to be used in the research. So for the market research, we use for the competitors, Google G+ was one of the major competitors in Uganda and Alexandra Medical Center. For the rest of East Africa, so for Kenya, we had 7 doctors and Babylon in Rwanda. Babylon in Rwanda, actually during the COVID pandemic, expanded its services, especially in Kigali. And HealthX has actually just opened up last month in Kenya. So the rise in telemedicine service providers was picking up. Nakasero Hospital also identified that telemedicine was a trend, and they picked up on that, majorly doing medical drug delivery. And the standout campaigns that we had Rocket Health on *280#, which was majorly an awareness drive that was pushing telemedicine consultation and service provision via USSD codes. This was a very big campaign to be like in August, especially in June 2021, that really pushed awareness to Rocket Health as a brand and as a telemedicine service provider. Then Rocket Health Women was majorly highlighting women in Rocket Health because the Women's Month that happened in March 2021. Spot the Rocket was a campaign that identified Rocket Health billboards around Kampala town. This was a major campaign between February and May 2021, especially on the Twitter platform and also Instagram. Then Rocket Health had campaigns that would have third-party partners, like for example, Safe Border. So we had a campaign like SB Safe Health that promoted self-help, sorry, in partnership with Safe Border. And Black Friday sales pushed up sales online, where they were pushing online sales via their eShop during the month of November 2021. Yes, I think that's it for me.
Thanks so much, Dan. Just to draw a line under that, that USSD code was really a game changer as we saw it for Rocket Health, especially given the fact that in our focus groups and our surveys, the issue of accessibility, like Mercy was saying, connectivity, how many people actually have smartphones to be able to send a WhatsApp, or who would want to make a free call or text message, really opened up that accessibility for Rocket Health from the way we saw it. So we've come to the point where we'd love to hear your questions. I'm just going to stop sharing screen so I can see people. We've got about 10 minutes. If anyone would like to ask a question, raise your hand, or maybe Osbert, you can open the floor. Just looking to see if anyone's speaking up. I see so many people have joined us. Thanks so much, guys. Hello, hello. Any questions from anyone? We'd love to tell you more about how we did the research, any other kind of insights that came up, especially while we have John Mark, if you have any questions about the company. Yes, okay, I see Jeffrey. Please go ahead, Jeffrey.
Hi, I would like to, first of all, thank Whitehead Communications for the amazing research, and also to the Rocket Health team for, really growing this thing. I've personally used the services before, and I think it's one of the best healthcare services I've used, and one of the most convenient. So, first of all, my name is Geoffrey. I'm a startup founder, but I've also had lots of health challenges, and with looking at how the healthcare system is set up, you literally have to either have your own doctor that knows you and that can give you priority, or you go and line up. So for me during the pandemic, that was like an amazing lifesaver. But back to the business side, I would like to maybe understand more about what were the biggest growth drivers in terms of adoption of the services, because what I looked at with Rocket Health, there was a lot of word of mouth. And even with the video that you started with, there were a lot of people saying, oh, someone told me about the service or something, or I learned about it from a tweet or a post on Twitter. But then you're also seeing a lot of billboards. You're also seeing a lot of adverts online on social media, like paid ads. Which of those was, I would say, the most effective in online to offline conversion, in bringing in sales? And also, which was the, I would say, volume driver? Because it's very easy to look at the online conversions and forget that there are a lot of people that are, I would say elites, that just, post about something and, share it. But then there are a lot of people who are not elites, and they're the majority that actually use the USSD code and maybe would use the service more offline, or more in an offline kind of setting that would be very different, but you never hear that noise. So yeah, I would just like to understand more about the conversion and what was the most effective.
Thanks, Jeffrey. I think I'll pass that question on the drives of growth to John Mark. And there's a similar one in chat. Before we get to our next couple questions, there's a question from Brian Banks here about what types of clinical services are available in addition to mental health. If you could take those to John Mark, and then we'll go on to the next questions.
Thank you, Geoffrey. Thank you, Brian, for the questions. Very good questions. So one of the things that happened is that towards the end of 2018 and at the start of 2019, we engaged the insurance companies, the private health insurers in Uganda, regarding adding our telemedicine service on their range of service providers. And of course, they were hesitant at the start. What then we decided to do with them is to do a pilot which introduced our services, and on a smaller sample of people, try it out and see how it works, what cost savings it gives them, how well does it work in terms of clinical outcomes, how well does it work in terms of convenience. And after the 6 months, we got some early adopters like the UAP, Old Mutual, taking on the service. And then what happened is that, just at the start of the pandemic, because of the nature of the inability to get physical services, one of the biggest drivers of the growth was we've been able to sign on up to 12 insurance companies in the last 2 years. And so all the major insurance companies, including UAP, ICA, Prudential, Liberty, AAR, and the international ones like Aetna, Cigna, and the like. And so what happens is that they have a combined membership of close to 500,000 people. And so those have been some of the reasons we had regarding our growth, because then what we've done is that we've been sensitizing and communicating to those people, and it's a large market, and that has been one of the reasons behind our growth. And when it comes to healthcare, of course, there's a lot of trust issues, and a lot of people, like Geoffrey mentioned, able to use the service, especially if someone else who has used the service recommends it. And so we know that on our side, there are things that we do, like the online presence, billboards, and the like, which create more brand awareness, which provide top-line knowledge about the service and the company. But the ultimate thing is that we always need to strive to provide a quality service, because that is the best way that more people are brought into our ecosystem. Because when somebody comes to deliver your medicine, and your neighbor at your office says, "Oh, who are these guys who are delivering the medicine?" and you're able to say, "This is Rocket Health, they always bring my medicine," you'll be able to use the service next time. If somebody comes and picks up your COVID sample at home, what happened is that would have many of our technicians ending up with many more samples than they had actually planned to go to, because people would even tell their neighbors that there are these people who are able to come to you and pick these samples. So a lot of these efforts are complementary, but we know that the best thing that we work on and we continue to work on is the quality of service, because that's the biggest seller. Brian asked about the range of clinical services. So we have general outpatient services provided by doctors, clinic officers, nurses. So any of the outpatient elements, we are able to take care of them. We also have specialist services on specific days. We have a physician, we have a pediatrician, we have a plastic surgeon. We also have, of course, a mental health specialist who comes in. What's going to happen this year and the years to come is that we're going to have more full-time of these specialists. So you'll be able to walk into any of our outlets and you'll be able to find not only the general doctor, the general practitioners, but as well as the specialists. The other thing which is really popular is the home-based vaccination services. So we have a team of nurses, clinic officers who can come out to you actually to get your your vaccination done. This is for all the childhood vaccinations as well as the adult vaccinations like yellow fever, hepatitis, and the like. And so that is also one of the popular services that we're able to provide. Thank you.
Thanks, John Mark. So I'll take questions from Mamelo and Francis, and I also see a question from Salim Karmali in the chat asking if we have ambulance services. That might be for John Mark, but first, Mamelo, if you could ask your question.
Good afternoon, everyone. Thank you so much for this discussion and, of course, significantly the report. My name is Dr. Mamelo Muhanuzi. I'm a healthcare management consultant, but also a medical doctor. And incidentally, I was working with Nakasero Hospital as the acting head of medical services when in the initial phase of the pandemic, and we had a webinar that was really well attended by the doctors, just looking at the role of telemedicine in the Ugandan context. Dr. Davis, I think, was also part of that discussion, and it's very interesting to see how initially in the pandemic there wasn't a very solid understanding of how it would work and whether there would be buy-in, especially from the doctors and the specialists more so, and how then they would deliver these services. So when we had the webinar, it kind of dispelled a lot of can I say maybe any disconcertations that they may have had around how do we give care via telemedicine. So I'm really happy to see that Rocket Health has picked up. The statistics are quite interesting and very, very, rewarding in the sense that people were able to get care during the pandemic. So first and foremost, congratulations to Rocket Health. Then I have a question about escalation of care. And I think Dr. John Mark has spoken briefly about it. But I think from a statistical perspective, it would be important to see how many of these telemedicine consultations are actually requiring to come in for a physical consultation. Because the essence of telemedicine is that people should really be able to get that full spectrum of care without having to physically come into the hospital. It would be important to look at how many of those are coming to the facility. I mean, if you have the data, you can share it, but also then how many of those then require to then be transitioned either into hospital care or medical center, level kind of care. And this refers mainly to the admission type of care. Then secondly, to look at, the knowledge and attitudes and practices around especially the upcountry, the rural population, because you said you're going out of maybe Kampala and into the other bigger, cities around, and seeing how they perceive this new way of taking on a doctor-patient relationship vis-a-vis the kind of disease patterns that they have around there. Why I'm saying this is because we did see a number of patients and doctors, yes, calling into the hospital and saying, we want to see our doctors, how do we come there? And so when we started to speak about telemedicine and opened up a platform and said, you can actually call your doctor and come and visit the doctor, and have that consultation over the phone, most of the patients would then somehow find a way of saying, but doctor, can't I come and see you physically? So I think this is something that if we are going to be talking about expanding Rocket Health outside of a pandemic situation, outside of a lockdown measure, then it's probably something that we would want to, put our finger on and understand well. So once again, thank you. And thank you for the good work.
Thank you so much for that submission, Doctor. Good questions about the escalation of care, perception and uptake up country as well. What I can say is we do have a little bit more feedback on the upcountry perceptions in the report, so you can take a look and maybe we can continue this discussion. I'm just going to ask Francis to quickly ask his question and then we'll pass it over perhaps to John Mark to answer those.
Thank you, Anne. Thank you, everyone on the call. This has been insightful. Just for the interest of time, I'm going to ask about 2 aspects. To the team of Anne, I needed to know what was the interplay between the research and the policy side of things, because early last year, Uganda passed a healthcare insurance bill. So how did that come to play into the operations of the players in the insurance sector, especially telemedicine? And secondly, to Dr. John, in Kwaz Africa last year, they ran an article regarding regulation of telemedicine in Africa, specifically for the startups. I needed to know what the regulation regime looks like, and is it in any way going to help in building more confidence to the brand and also building the entire industry as a whole. Thank you.
Thank you, Francis. If I can quickly just respond first, and then I'll pass it to John Mark on the interplay of research and policy. I should say that we didn't specifically touch on any questions to do with government policy in our surveys or our focus groups. So it didn't exactly come up, but it's possible that in the discussions online that we were kind of downloading and sorting through that data, we could go back in and look for mentions of that policy and see how it played out. So there's potential with this kind of research to answer those questions, but I don't have the questions for you today. So just to pass over to John Mark, there's a question about ambulance, escalation of care, and I think there's a couple others showing up in the chat if you want to take a look. Thanks.
All right, thank you. Very good questions. Thank you, Dr. Muhanuzi, and thank you for leading the team also who are looking to build the whole telemedicine ecosystem, especially from an established player. I think things like that and efforts like yours from the Kasarani Hospital are what actually adds to the confidence around telemedicine, so that it's not just the new players, but also even other established players. And indeed, one of the things that happens is that, like I said earlier, because doctors and other medical professionals have, all our training has been structured around providing healthcare within the physical confines of hospitals, of clinics, and the like. And so it is no wonder that some might have hesitations around things like telemedicine service. However, what we do and what we continue to do is, on one hand, do as much research around telemedicine and digital health, and we have quite a bit of research that has been published. And the interesting thing is that because telemedicine and telehealth can be applied to a wide range of aspects of healthcare provision, what we've done is be able to do assessments or reviews on particular aspects of healthcare. So it could be, how can telemedicine be used for delivery of HIV self-testing? How can it support HIV services? How can it do different aspects like that? And so you eat at the problem in small bits that are chewable, and then we've been able to share, to publish and share at conferences all this research, and and Sandra also and my team can help to share where all this. And the reason for this is really to build confidence, especially in the medical community, around the implementation science and approaches when it comes to telemedicine. And also what we often do is also try to be as honest as we can about the successes that we get, as well as the failures, things that do not work, so that anyone, ourselves, but also anyone else who comes up after us is able to not repeat the same mistakes, but learn and be able to deliver things better. We think that over time, more evidence, especially testimonies also from people who use the service and get optimal clinical outcomes. The evidence is going to build up around how telemedicine can actually be incorporated and integrated for a lot of the doctors in very many different aspects. When it comes to how many people require physical admissions, the percentage is between 5 and 10%. And the reason is that a lot of the people presently use telemedicine, of course, for outpatient service, because our service provides an end-to-end kind of offering, which layers teleconsultations with a diagnostic aspect from the lab and also a medicine service. It's very easy for us to be able to identify those cases which we cannot manage through that mechanism, and hence refer to inpatient partners, because once we have even some diagnostic information, it's easy for us to make or for the medical team to make the judgment on the referral. A number of other players in the industry do not have that integrated end-to-end service which links the remote consultation with the diagnostic aspects, and so that provides a gap in easy and right assessment for what needs to be referred. And so we continue to do that in terms of how can we quickly assess and refer people who need the physical aspects. And this is across the different healthcare conditions. One person was asking about non-communicable diseases, people with chronic conditions like diabetes, hypertension. We have a large number of those. And the reason is that because these are people who need regular interfaces with the healthcare system, which most times only requires medicine refills or pickups and then periodic sample assessments. A lot of them are embracing our service because if you're diabetic or hypertension, you don't really need to go to hospital and spend all those hours just waiting for your medicine to be dispensed. You can actually use our service, call us, and we are able to bring your medicines to you and the comfort of your home, your office, every 3 or 6 months, pick up the samples and have our general doctor or physician review them. And you can just come into the physical facility once or twice a year to see our physician for a physical assessment. So in a way, it improves the quality of care and the convenience to the people. And because it's also layered on our follow-up, which we do through the telehealth platform, we are able to do home-based follow-up, which means that if there's anything that is going wrong, we are able to identify early, but also the beneficiaries are able to call us any time of the day and night to be able to report anything. And so we are able to identify any things that need escalation quite early. When it comes to upcountry adoption or rural adoption, the interesting thing, I think, if you looked at the first portion of my presentation, it looked at the work that we've been doing over the last couple of years, and the work that has been largely focused in the rural areas. This has been in partnership with large funding organizations like UNICEF, like USAID, and the scope of work, especially in the rural areas, has been focused on initially basic things like can people get a teleconsultation? Can people just call? Because these are places also that have a very low numbers of medical professionals. So some people in some of the villages in Uganda may go their entire life without ever interfacing physically with a doctor. They interface mostly with lower cadre health workers. And so giving them a toll-free line where they can be able to call and talk to a doctor is a plus. It may not be everything, but that's where you start from. Incorporating SMS reminders for them to return to health facilities for things like HIV treatment, viral load testing, for reminders to come and pick their hypertension and diabetes medicine. So a number of these things are things that we do, and we have hundreds of thousands of people that we support in the rural areas. And so the idea is that we started that way, but later we are going to layer on other services and increase the complexity of the services that people can be able to get using the telemedicine platform. And like I said, one of the things why this is also very possible in the rural areas is we have maintained basic platforms like USSD, like SMS, like basic voice call platforms, and not gone too disruptive in using very high-end technology so that it allows people like my mother, my grandmother, who is way out there in the village, to also be able to access the service. We think that if we continue with this, we'll continue to be more inclusive and allow more people to be able to use the service. Francis asked a very good question regarding regulation and of telemedicine. So as you might know, telemedicine is generally a new field across Africa and indeed globally. So a lot of the countries, including Uganda, do not have specific telemedicine guidelines yet. However, a lot of the work is ongoing, both from the Ministry of Health, the National Drug Authority, and other players on how to build telemedicine focused guidelines. However, players like ourselves have had to merge the regulation that is required, regulation and licensure that is required to run a clinic, the regulation and licensure that is required to run a pharmacy, the regulation and licensure which is required to run a laboratory, and bring them together to provide this integrated service. And so what then happens is that we are able to use these multiple regulatory bodies and then be able to show them how they can work together to provide the end-to-end telemedicine service. The interesting thing is that the more local and native players they are like ourselves, the more policymakers and regulators are able to generate real life evidence and case examples that inform their policy development, that inform the regulations that are appropriate locally and not just pick up things from other geographical parts of the world and just dump them on us. So what we always do is that we always participate in Ministry of Health and other technical working groups. We always present papers and our findings at different regulatory body meetings. And the reason for this is to share as much about our experiences, our learnings, and also make input in the guideline development. And we think that over the coming years, we're going to have the first drafts or even more developed guidelines and regulatory frameworks for telemedicine.
Thank you so much, John Mark. I think we should start to wrap up now. Maybe I'll just give you a chance to take a look at whatever's in the chat and you can mention in your final remarks. On my side, first of all, I want to thank everyone who joined us today or is joining us later on the YouTube channel. I also want to thank everyone who was involved in this process. It was stretched out over a couple of years and we had a lot of great people both on Whitehead Communications side and on Rocket Health, including Dan Kayango, Owilla Mercy Abiro, Norman Angel, Joyce Jiang, Mabarizi David, Angela Kazito, Sandra Aranetwe, Hilda Kamarembe, Priscilla Akora, Patricia Anuta, Davis Rotich, Osbert, Mwijuche, John Mark, of course, Dr. Davis Musinguzi, who's not with us. Just as a final screen here, let me just share our contacts. We're always happy to, this is a starting point. The reason that we're sharing this today is that we want to encourage more research like this, whether we're part of it or not, it should be done. We'd love to be part of it. So please get in touch, Anne at whiteheadcommunications.com. Definitely CC my research coordinator in Kampala. That's Owilla Mercy Abiro, research at whiteheadcommunications.com. And then, pardon, Sandra and the team at Rocket Health, you can get marketing at tmcg.co.ug. Again, thanks so much for coming. Maybe you can just give us some last words, John Mark.
No, thank you, Anne. I think I'd like to just thank everyone who has, of course, taken part in doing this research and also bringing this report to life. I think you guys have done an incredible job. I would also like to thank everyone who has tuned in and come to listening to this work. I think it's always very validating when you have people who are willing to come and listen to the work that has been done. But also I'd like to thank all the research participants. They were able to accord us time and get these insights. These insights are what make us better. They're the foundation for our growth. They are the ones that help to validate our assumptions, but also push us forward. And we don't take that for granted. So thank you. And I hope that in the few years to come, Rocket Health will be the healthcare provider of choice for anyone with a mobile phone in Africa. And we believe that, and we're going to work towards that, and we know that it's going to happen. So thank you, and keep watching the Rocket Health work. I think we are going to be doing some really cool stuff in the coming years, and I hope that a lot of you will be beneficiaries of those things. Thank you.
Thanks, everyone. Yes, thanks again to our participants, everyone here. Find us online. The report is there. Just look on the Rocket Health website, and we'll see you next time. Take care. Bye.
Bye.